My name is Panida Piyachaturawat. I am a co-author of this study. This is Dr. Wiriyaporn Ridtitid, who is the first author of our study. We are in divisions of gastroenterology, Faculty of Medicine, Chulalongkorn University, and King Chulalongkorn Memorial Hospital, Bangkok, Thailand. On behalf of Professor Ramsang Rangnimet, who is the corresponding author and all co-author of this study, we would like to share our recent paper in endoscopy on intermediate to long-term outcome of endoscopic transpapillary gallbladder stenting in patients with gallstone-related disease, a 10-year single-center experience. Let's talk about the reasons why we did this study and our motivations. Recently, endoscopic gallbladder drainage have been proposed as an alternative treatment strategy in patients with symptomatic gallstone disease who are at high surgical risk or whose cholecystectomy is deferred, including endoscopic transpapillary gallbladder stentings and endoscopic ultrasound transmural gallbladder stentings. Endoscopic transpapillary gallbladder stenting provides an effective bridging therapy to elective cholecystectomy in patients who have the future planned cholecystectomy due to its ability to preserve the gallbladder anatomy and can save an appropriate treatment options when patients at high surgical risk who require permanent gallbladder drainage have contraindications for percutaneous cholecystomy and EUS guide gallbladder stenting. So our retrospective study aimed to investigate the daily event-free rate at 6-month follow-ups, which is intermediate terms, and more than 6-month follow-ups with defined long terms after endoscopic transpapillary gallbladder stentings in patients with gallstone-related disease who has a high surgical risk and whose cholecystectomy was deferred. Then what is the outcomes and why is this important?
In our study, we retrospectively reviewed 234 patients who were unfit for surgery and deferred cholecystectomy, and all underwent endoscopic transpapillary gallbladder stenting between 2012 and 2021. Overall technical success rate of endoscopic transpapillary gallbladder stenting was 84.6%. At 6-month follow-up in 193 patients, overall biliary event-free rate was 99%. Recurrent cholangitis occurred in 2 patients due to stent occlusion in 1 patient and stent migration in 1 patient. Based on our Kaplan-Meier analysis, in 193 patients, overall biliary event-free rate was 92% at 1-year follow-up and 76% after 2-year follow-up. When the subgroup analysis was performed in patients with and without acute cholecystitis, their intermediate and long-term results were comparable. These data highlight endoscopic transpapillary gallbladder stenting as a highly effective treatment to prevent recurrent biliary events in intermediate to long-term for gallstone-related disease patients. To avoid percutaneous cholecystostomy-related adverse events, which usually develop within 3 months, endoscopic transpapillary gallbladder stenting should be considered as a viable option for temporary gallbladder drainage in acute cholecystitis patients with confirmed common bile duct stone, whose surgery cannot be performed in the same admission, but that patient is the candidate for future cholecystectomy. In those with common bile duct and gallbladder stones without acute cholecystitis, who may have a long waiting time for cholecystectomy, especially during COVID-19 surgical lockdown, endoscopic transpapillary gallbladder stenting is an interesting option during ERCP for common bile duct stone removal. So what are the next steps of our study? Since the main limitations of our study were the nature of retrospective design and a lack of a control group, randomized control trials comparing patients receiving or not receiving endoscopic transpapillary gallbladder stenting are warranted to confirm long-term effectiveness of endoscopic transpapillary gallbladder stenting in patients with gallstone-related disease who are candidates for future cholecystectomy. Further evaluation are needed to determine the proper strategies of endoscopic transpapillary gallbladder stenting, such as intermediate term drainage in patients with long waiting times for cholecystectomy or more than 3 months, and long-term drainage in patients who are indefinitely not a surgical candidate.
Sir, in conclusions of this study, we conclude that endoscopic transpapillary gallbladder stenting should be considered as a possible option in selected patients with symptomatic gallbladder disease who have common bile duct stones. Our study demonstrates a very event-free rate, 99% at 6 months, 92% at 1 year follow-ups, and 76% after 2 year follow-ups. Thank you.
Thank you very much.